There are more than 2.9 million reported cases of COVID-19 worldwide and over 200,000 deaths. Now we have new information out today about symptoms of the deadly disease. Let's bring in Dr. Shoshana Ungerleider. She's an internal medicine physician with Sutter Health. Doctor, good to see you again. So the CDC has added 6 new possible symptoms of COVID-19. Walk us through what they are.
Yeah, thank you, Vlad. As we all know, this is a new virus, and we're learning about it as we go and trying to gather as much new data as possible. And we found that the initial symptoms people present with can be highly variable. Things like chills, muscle pain, headache, and sore throat are common and then often accompany viral infections, including COVID. Interestingly, we've heard that the loss of smell and taste can be some of the earliest signs of a COVID-19 infection, and sometimes it can be the only sign, although it may not affect every patient with COVID-19. We know that the loss of smell and taste are definitely associated with the disease, and therefore we can use that as a screening tool. Some of those other symptoms typically accompany many other kinds of viruses, so we should all be kind of paying attention to new symptoms as they arise, but especially that loss of smell and taste.
So we've talked a lot about how people with underlying health conditions are the most vulnerable, but what that means is still, I think, debated, at least among sort of regular people. Obesity is on that list. How does obesity affect your susceptibility to the virus?
Yeah, that's right, Anne-Marie. Severe obesity is correlated with more severe cases of COVID-19, so those that require hospitalization and intensive care. So people who are obese, of course, can have other high-risk health conditions like high blood pressure or diabetes. However, even patients who don't have other underlying health problems, we're finding those folks are getting sicker from COVID and requiring ventilation. And this may be because severe obesity predisposes people to breathing problems. They may have underlying sleep apnea, which impacts your lung function overall. And then we also know that obesity impairs your immune system, which is your ability to fight off infection. So in America, 40% of people are considered obese, and 18% of Americans are considered to be severely obese. So we're learning that potentially many millions of Americans are at higher risk of severe illness from COVID, unfortunately.
That is troubling because of the statistics that you mentioned, Doctor, with regards to here in the United States. I have another question for you, which has come up recently. The World Health Organization says there's no evidence to support that having coronavirus or COVID-19 prevents a second infection. I mean, I know that this is there's still a lot that we're learning about coronavirus and COVID-19, but what do we know about people who are infected with COVID-19 and whether or not they can be reinfected? Presumably, if it's like most viruses, you do develop antibodies once you are infected, right?
That's right. And this is really important. I think you pointed this out. There's still a whole lot that we don't know about the virus, including this very important question of immunity. Meaning, right, if you get infected and create antibodies to it, proteins in the blood, are you then immune to getting it again? And if so, for how long does that immune response last? Those are the key questions. We just don't know whether or not patients who have these COVID antibodies are still at risk of reinfection. Typically with other viruses, you do create an antibody response. It lasts for somewhere up to weeks or months. But unfortunately, until we do know in the case of COVID, we have to assume that even if you test positive for antibodies, you could be at risk for getting it again. And so people who do test positive for those antibodies shouldn't change their behavior in any way at this point. It's important to continue social distancing for now.
Okay, so if you do have the antibodies, though, we've been seeing stories of people donating blood and so on and so forth. If you've had the virus, you've recovered, is there anything you can do to sort of help in this quest for a vaccine?
Yeah, that's right. There are, in some places, they are doing studies about whether or not donated plasma from people who have recovered from the virus. Whether those antibodies can then be transfused into people who are actively fighting the infection. The jury's still out. We don't know whether or not the convalescent plasma donations are actually helpful. But if you are somebody that's recovered, it definitely makes sense to look up whether or not in your area you're able to go and donate plasma to potentially help people.
Doctor, before we let you go, I've got a question about the fabric mask that everybody is now wearing in many states. Here in New York City, you go outside and you see most New Yorkers wearing them. What's the correct way to care for a fabric mask to help effectively prevent infection?
Yeah, great question, Vlad. Right, so cloth masks are everybody should be wearing if you have to leave the house. These should ideally be washed after every use in a washing machine, if possible. And be really careful to not touch your eyes or your nose or your mouth when you're taking off your mask. And then, of course, wash your hands immediately afterwards, after touching it with soap and water for 20 seconds. And then another important thing to note, if you've been wearing your mask for a while and you have holes in it or it stretched out and it's no longer covering your nose and your mouth, it needs to be thrown away. So people should know that masks alone are not particularly effective in preventing infection. The best way to prevent getting COVID or to prevent infecting other people is to stay at home if you can.
All right, Dr. Ungerleider, thank you so much for all the information that you've given us. Appreciate it.
Thank you.